I'm on a quick break at work, but I wanted to share a little bit about hanging multiple pressors on patients to reduce bolusing the pressors. So my favorite device to use at work is this little three-way port. We call this a turkey leg, but basically you have three ports that all connect to the same spot. So when we're hanging multiple pressors, I love this because that way all your pressors are super close to the patient and it reduces the amount that you're going to bolus if you're changing any of the rates of your pressors. Typically, this is connected up to a central line. Not usually a good idea to infuse pressors in a peripheral line unless you have no other option. But I want to share a little example of something that happened on a shift a couple weeks ago. I was helping a nurse in her room, and this patient was already on two pressors. They were on neosynephrine and vasopressin, and the nurse needed to start her third pressor, which was Levophed. So she had the vasopressin and the neosynephrine in two of the ports, and then she connected her Levophed on the third port. It only started at like 2 mics, which is like barely anything. And immediately the patient's blood pressure went from like 80 over 40 to 130s over 70s. And she's like, what the heck? Is the patient super sensitive? And I said, no, probably not. What happened is there's a little bit of pressor mixed right here throughout the patient's line. And when you connected your third pressor, you essentially bolused it just very slightly, that whole line of pressors. So you can imagine if that happened with just this little amount that was in there, if you have your lines all piggybacked onto one another, you're going to end up giving your patient a scary, scary blood pressure. What I mean by this is on your IV tubing, let's say you connect your Levophed directly to the patient, and then on that first port, you connect your vasopressin, and then on the vasopressin's first port, you connect your neosynephrine, and then on that one, you connect your epinephrine. Now you have this whole chain. So if you change the rate of one of those drips, you're changing the rate of all of them. This can be very scary and give your patient a very, very scary blood pressure. So always put your pressors as close to the patient as possible using something like this, or there's lots of different devices out there. I'm sure your hospital has something that you can get that is similar to this. I hope this is helpful. I teach all types of this stuff in my ICU crash course, which is linked in my bio. So if you want to learn way more stuff about the ICU, go check that out.